In preventative dentistry, CRT bacteria is used as a diagnostic tool to identify patients with a high risk of caries. These patients have a high rate of caries lesions, and we want to find the cause. It is a tool by which we analyse the patient's salivary flow. To do this, we give a bar of paraffin that stimulates saliva, and we can calculate the rate of stimulated saliva per minute. Later, this saliva will be used to calculate the salivary pH. We have a test strip, and then with this, we calculate the pH of the saliva. If this patient has an acidic saliva, this would favour the formation of dental caries, or if he has a bigger basic pH, which would be a protective factor. The kit provides two culture media, one for Streptococcus mutans and the other for Lactobacillia, which can be impregnated with 3 droplets of saliva. We introduced them in the pipe that we have in the kit, and we took it to the incubator. It will remain in the incubator for 48 hours at 37 degrees. Once 48 hours have passed, you can extract it and proceed with the interpretation of the results. We interpret the results by comparison with some boards with which we compare the colony-forming units. We can determine if our patient has more than 100,000 colony-forming units per millimetre of saliva, in which case it would be a patient with high caries risk, or if he has less than 100,000 colony-forming units, in which case the risk of decay would not be so related to the bacterial load. Once we have completed the dental hygiene, we proceed with the topical application of fluoride to prevent dental caries. Then we should introduce a tray for about 2 minutes. It is important not to swallow it, and we will leave the ejector properly positioned so that all excess of fluoride would disappear. It is important not to swallow and to have the tray with fluoride enough time inside the mouth. The first thing we should do is to try the tray to see which is the best size for the patient. Once we have seen which one is the right size, we should put the necessary amount of fluoride in it. We have to place a row of fluoride in both the upper jaw and at the bottom of the tray. Now you have to open your mouth. We introduce the tray. Bite. If you have a remainder of fluoride, do not swallow. Once we remove the bowl, it is important to remove all excess with an ejector. Now you cannot rinse. You must be at least 1 hour without eating or drinking anything to allow the effect of the topical fluoride. The pit and fissure sealants are a preventative measure in dentistry to prevent the formation of caries lesions in occlusal surfaces of molars and premolars. It is a barrier that has an immediate effect to prevent the formation of dental caries lesions in occlusal surfaces of both children and adolescents. It is not routinely indicated in all patients, and it would only be focused on patients with high caries risk, identified by their dietary habits, past caries experience, and according to the morphology of the occlusal surface. Based on these factors, we would identify those patients who are at high risk of caries and would need the preventative measure. The advantage of this technique is that the effect is immediate, because what we do is to produce a lock on the entire surface of pits and fissures, and once it's applied, its effectiveness is high. The effectiveness of the preventative unit is closely related to the permanence of the sealant in the mouth. Once we have put a sealer, we will make periodic, annual or biannual controls to control the permanence of the sealant in order to avoid filtration. If there is any leak, we would have to remove and replace it.